So let's take it simply like my hand here. This bit, so this is the foot pipe, is like a pump. And we've got a valve there and a valve here. So the foot comes from the mouth. This valve opens. The foot comes into the foot pipe. This foot pipe pushes the foot down, and this valve opens and the foot goes down into the stomach. So that's how the normal foot pipe works. In achalasia, we've got a problem with two of these three areas. The top area is fine. This pump which pushes the foot down into the stomach is not working. So it's essentially, it cannot push. There's no push. And this valve which opens up does not open up. So food which comes here, it opens, it comes into the foot pipe. The foot pipe is not pushing. So it just languishes there. And this valve is not opening. The foot pipe normally takes in liquid food, solid food, semi-solid food, and it pushes across. In any problem with what we call motility issues with the foot pipe, usually there is a difficulty in swallowing liquids. However, if there is a problem with a blockage, for example, if someone's got something stuck down there, or rarely a cancer, then there is initially a more problem with solids. However, the patients will learn to adjust on how to eat in the initial stages of achalasia. For example, they might eat something, it's not going down, and they might adopt to certain mechanisms like trying to push it or drink water to flush it down and get the food down. Generally, anything very hot and spicy is something we ask people to avoid. As anywhere, anything hot and spicy can go and irritate. So anything irritating causes inflammation within the foot pipe. Rarely it can cause ulcers. Sometimes, although none of us go drinking acid and alkali and all that, these are highly inflammatory, damaging structures which can cause intense damage and rarely cause a hole in the esophagus, which is a very dangerous thing. Once it's diagnosed and treatment is given, you can still live a normal life with regards to eating as much normally as possible, carrying on with your daily work, carrying on with your daily profession, and enjoying life with your normal quality of life. There will be some restriction as to certain types of food which you will attune to and get careful with that, but the quality of life should be significantly better and near normal if we have good symptomatic relief. Unfortunately, yes. We've got to understand that achalasia is a disease of the foot pipe which has no cure, absolutely no cure. The pump mechanism of the foot pipe is never going to recover, and the valve which opens up is what we target in trying to help with the symptoms. The tight valve, we do treatment to make it open up so that the foot can go down, but we cannot do much to improve the pump mechanism of the foot pipe. So can it get worse? Before the diagnosis, it has got worse to an extent for the patient to seek attention. And after treatment as well, sometimes over years together, it has a potential to get worse, in which case we might have to repeat treatment or do some other form of treatment. Unfortunately, in a small number of patients, the achalasia gets worse to a degree where the standard methods of treatment don't work. The esophagus, let's say the esophagus is something supposed to be a pipe like that. let's say if it's supposed to be like that, over time, the food comes in and it's not going down, it's not working, it balloons out to become a really, really dilated out, something which should be like this, can dilate up to something being like that, and it can get a bit baggy and saggy, and it just doesn't work. We have very rare situations where it doesn't respond to the standard methods of treatment, and we have to adopt to some really radical methods of treatment, which is fortunately not usual. But although I sound negative, in most of the patients, treatment helps a lot and it can get back to a near normal quality of life. But we have to understand it is not something we can cure.